I started to have fungal nail problems about 20 years ago. I did go and see my GP, who put me on a course of medication for it.
In this country, we tend to use or prescribe terbinafine, which is an antifungal tablet which has about a 50 to 60% success rate, however can have some quite dire side effects, ranging from losing your sense of taste to having liver damage, and you have to have liver function tests every month or so whilst you're on the tablets, so it's not a great choice for most people.
But at the time, I didn't continue with the medication because there was contraindication of me wanting to become pregnant or breastfeeding. So I had a long period of time, about 10 years, of not having any treatment for it. So consequently, when I started to come here back in 2012, my nails were in a terrible state. I haven't worn sandals for about 20 years because I wanted to cover them up, and in the summer would only wear closed sandals. I usually put nail varnish on them to cover them up as well, and I would avoid going to swimming pools and to beaches or anywhere where my toes would be exposed. Back in 2012, I had a few sessions with the pinpoint fungal nail treatment, which was a little bit more painful than the laser treatments.
And there are two main types of laser therapy. There's the hot lasers, which kill the nail fungus purely by heating the spores up until they die, and that costs generally around £750 for a course of 3 or 4 treatments in most clinics. That can be quite uncomfortable to have and is only as effective as pain tolerance for most patients. And then the other type of laser treatment is the cold laser, which is the lunular cold laser is the one that's available, which is a 12-minute cycle, treats the whole foot at once, has a very good success rate of about 90% in clinical trials of over 500 patients, and costs about £500 to £600 for a 4 treatment package. And that's the most effective treatment that appears to be out there at the moment.
And I've been having them regularly. Initially it was, I think, every week, and then every 2 weeks. It then went to every month, then every 6 weeks, and now I'm up to every 2 months. And today, fortunately, Martine did say that my nails were fungal free. So that's a massive deal for me because they haven't been for about 20 years. Hopefully I will now not be so embarrassed about my toes. I think my husband has referred them to pig's trotters in the past, and now I think he will also be quite amazed how they are. He has noticed the change in them too, which has been great, and fortunately I'm now able to put a little bit of nail varnish on them for special occasions. I'm delighted with the gel treatment today because they look like so-called normal nails, and this is a first in many years because they're actually smooth, whereas in the past my nails, although 2 of them were smooth, but they were the ones that were less affected by the fungal nail problem. They're very rough and coarse, so I'm delighted that now they are smooth, and they all look very similar as, I was going to say, as 10 individual nails.